So today what I am going to talk about, some nursing diagnosis, common nursing diagnosis with its intervention. See, common nursing diagnosis, I'll explain today with the nursing intervention so that it will become easy for you to prepare the nursing care plan. Okay? Is that okay? So what
Yes,
are
ma'am.
common nursing diagnoses you could prepare till now? You are writing mostly because some of the nursing diagnoses like uh, knowledge deficit and all this kind of nursing diagnosis you people are very fond of writing. Anna? So can you give me some
Yes, ma'am.
example of what kind of nursing diagnosis you have written about till now? You are taking care of some patients in the ward, right? So what nursing diagnosis you have formulated mostly? I just want to know few. Speak everyone. Just whatever you
Ma'am,
remember.
impaired physical mobility, self-care deficit,
Okay. Okay. Self
acute pain,
acute pain. Okay.
impaired physical mobility,
Yeah, somebody
risk
said
for infection,
risk for
fluid
infection,
volume deficit,
fluid volume deficit. Yes.
impaired skin integrity, risk for injury,
Risk for injury and
risk for infection,
risk for infection. Can you tell something specifically related to childhood nursing? Did you also refer books? Some of the nursing diagnoses like delayed growth and development or risk for delayed growth and development, deficient diversional activities, these are specifically for child health. Could you ever see it somewhere or you have written or have you heard? Yes, no?
no ma'am.
Okay. So some of the nursing diagnosis basically common to child nursing also I'll be explaining a little bit, okay? So this will help you to understand and don't be very hurry to take the screenshot. First you try to understand, then you take it because the screenshot taking it is not going to take so much of time, right? Okay. So, first nursing diagnosis, imbalanced nutrition less than body requirement related to what? See, this related to when you write the related to, this part you have the problem. Listen to me first, everyone, okay? This part, sometimes what happen, you just concentrate on the nursing diagnosis because that is already in your mind. You want to write that whether it is supported by the assessment you are doing it or not, you do not see it because you want to write that and then you keep on writing that. But you have to see what is the nursing diagnosis. That has to be based on the subjective data as well as the what? What? Subjective data and objective data. So objective, yes, subjective data that you will get from the patient as well as the attendant, right? And then objective data that you will get by doing your observation. By observing, you will do the assessment. On the basis of that, you will find that, right? So this imbalanced nutrition less than body requirement, this might be related to what? Maybe related to loss of appetite. The child will be presenting with loss of appetite. Alteration in taste. At present COVID is having this. Yes or no? We have alteration in taste. We do not get taste. If you are infected with COVID, you will not get the taste. Yes or no? Do you know about this? Inability to ingest, digest, absorb nutrients. You will see that there is indigestion, frequent indigestion in the child. There is nausea, there is vomiting, there is diarrhea, there is constipation, there is abdominal pain, there is oral ulcer the child cannot swallow. Okay. So this imbalance nutrition might be related with this. Now, what are the observation you will make on the soil? I told you this might be the related factor. Related factor means this might be the cause. This will be the nursing problem, the nursing diagnosis. And this is the that day what are the three parts I said of nursing diagnosis? First one is three part we have in
Actual,
yes, in actual nursing diagnosis, what are the three parts we have? What are the three parts we
ma'am,
have?
diagnostic level, related factor, and defining characteristics.
Yes. So this is the diagnostic level, right? Imbalance nutrition less than the body requirement. So this is the etiology, right? The related factor. The related factor is the etiology, right? And then just for you to make it little bit clear, for you people to be a bit easy, I have given these things, what observations you will be making on the child. Child will be having anorexia, nausea, vomiting, diarrhea, abdominal pain, lack of interest in food. Child will present with lack of interest in food, there will be weight loss. Okay. Sometimes you write that there is imbalance nutrition, the child is looking lethargy. Okay, maybe looking lethargy. Weight loss might be there. How much weight loss is there? That you have to find out. On the basis of that only you can say that it is imbalance nutrition less than the body requirement. Okay, you have to justify it. Understand? You have to justify it how you are saying that there is less nutrients the child is getting. Okay, could you follow me? So these are the observations you will make on
Yes,
the
ma'am.
child. On the basis of that, you will be then only you can say that this child is having this nursing problem. Okay. Next, what should be the goal? We take the goal. You remember the phase of your nursing care plan. First, we write the assessment, then nursing diagnosis, then your goal. Yes or no? Or something else you write.
Yes, ma'am.
Yes. So goal. What goal you will be taking for this nursing problem, nursing diagnosis? Child will ingest adequate amount that should be appropriate for age. Now, what you have to see that how much amount, how many meals the child is taking in a day. Okay, in a day how many meals usually the child is taking, and is it reduced now or it is increased in terms of amount or amount as well as in terms of number of meal. Understand it? So you are taking the goal that child will ingest adequate amount that should be appropriate for age. So for example, if it is a young child, we give small and frequent meal. If it is a older child, so little bit of the number of meal is a bit less as compared to the younger child. So those things you have to keep it in mind while writing the care plan. Okay, while assessing it, while taking the goal. What are the nursing intervention you can take? Assess the food intake first. Formula, if the child is being given formula feeding. Breast milk, how frequently the baby is taking breastfeeding. If there is any financial influence, cultural influence, they are not they are not able to afford food because of financial crisis, or they have less money to buy the food, and then cultural influence, they think that these are the foods not to be given to child, or these are the food when the child is sick not to be given. This kind of some kind of beliefs they are having. So is it influencing that? These are also you are supposed to find it. Assess appetite, weight, height, head circumference, compare with the standard value. This I told you from where you are going to compare it. Okay? Do you all know about it? The standard values, height, weight, head circumference, at least to those students I have talked in the word, please respond. Do you know about it? And please talk. The standard values, we have some charts. I told you to refer those when you compare the child's physical parameters. Did I tell you? Some of you, I'm very sure I told some of the students. Yes?
Yes, ma'am.
Yes, what?
Ma'am, you told us to refer from
Hmm.
one book.
Dapila, are you
For
speaking?
guy.
Is it Dapila speaking? Is it Dapila speaking?
Yes, ma'am.
Yes, tell. From where?
Yes.
From where?
Ma'am, from that book, Upur Bagay.
What is that book? Opigai. Opigai.
Yes, ma'am.
Also we have one more book. I have seen lots of copies in library. Okay, Meherban Singh Pediatric Clinical. Uh, Pediatric clinical notes. Something was there. Pediatric clinical methods. Yes. Meherban Singh. Have you seen that book in library? Our own library, college library. Have you seen it? That book also it is there. That is the updated one because that copy is a revised one, the updated one. Okay, new edition book is there. Please refer. You can refer that OPGI also and Meherban Singh that book also. You can pediatric clinical method. It is not the newborn care. Okay, Meherban Singh we have 3-4 books. It is the pediatric clinical methods. That book you refer. We have the values. All these charts we are having, please try to compare once you take the height, weight, whatever physical parameters you take from the child for the assessment purpose, please check. Please compare. Okay. Assess for difficulty in swallowing if anything is there, condition of the mouth, any ulcer formation is there, presence of nausea, vomiting, associated conditions like diarrhea, bile sound is there or not. These kind of things you are going to check it. Next, the plan for comfortable position for feeding. For example, for infant on the mother's lap, because this matters. You might be thinking this is not important, but this is important. Okay. The emotional aspect of it. You have the food in front of you. Somebody will be angry with you at that point of time, and offering the food, you may not feel like swallowing. You may not feel like eating, and that has the effect. Okay. So for an infant, it is important that you ask the baby to be on the mother's lap and then feed the baby, and ask the mother also to do that. Small frequent feed, 4 to 6 minutes. This is for the younger child. Food from home. When the child is hospitalized, it is preferably if you can ask them, because specifically the toddlers they like the sameness. They have a fixation. They have some problem with the sameness. They want the things to be same. Okay, once you give food from hospital, the look, the taste, the amount, many things may be different. They may not like it. If you ask the parents if it is possible, bring from home, that is good. That is to be encouraged. Okay. If TPN, what is TPN? Will you respond, anyone? What is the full form of TPN? This is in connection with feeding.
Total parenteral nutrition.
Yes, very good. Total parenteral nutrition outside the GI tract. Right? When you give intake and output nasogastric, this if it is there, that has to be monitored. This is continued. Okay. If needed, refer to nutritionist. Check for vitamin and mineral supplements. It is there. Deficiency is there. Specifically, yeah. The vitamin D in case of children, you can see vitamin D deficiency, vitamin A deficiency. This you will find it. So this has to be checked. Parents, for the parents, teach about the amount and type of food at different age and food hygiene. How to prepare, you need to give some kind of teaching to the parents, how to prepare, how to maintain the hygiene, and especially the in some special conditions like cleft lip pellet. Did that seminar over cleft lip pellet? Someone is getting seminar, I think. Lab leave pellet? Yes or no? Is that seminar over?
No, ma'am.
Okay. Lab leave
No,
pellet.
ma'am. Not yet.
Okay. So cleft lip pellet, do you understand there is a fusion in the lips as well as in the pellet? Okay. So in that case, what happens once you feed
No,
the
ma'am.
cell, it is likely that it is going to the nasal cavity, or it might enter to the respiratory tract. So in that case, the feeding becomes, the technique of feeding becomes different. So if that kind of problem is there in case in the child, how to feed, those special instructions you are supposed to give. Okay. Now in the evaluation part, these are the interventions I have listed out for imbalanced nutrition. So that you have to see. Just to have an understanding, I am giving you, I am repeating the things, okay? Just to have an understanding what kind of intervention you can take for what kind of problems. It is not that as it is you will be writing in your plan. You have to individualize it. Individualize it means you have to see for your child what you can do. This will only help you to make to understand what are the interventions you can take for this kind of problem. Could you follow me, everyone? Please respond. Could you follow me?
Yes, ma'am.
Okay, this will only a guide.
Yes, ma'am.
This will be only a guide. How to go about it, what kind of intervention you can take. Now when you evaluate, what you will say. So simply what is the term you write? The nutrition is maintained. Something like that you write without any validated something. Like with what you want to prove that child is really taking, improving the amount of food or the number of food the child has increased. This kind of thing you do not specialize when you write it. So it is very important. I told you that at the beginning you will be assessing in terms of the number of meal as well as the amount of meal the child is taking. So when you evaluate, you will have to see, you will have to assess that the amount of food has been increased or not, or maybe the number of meal has increased or not. So that you have to write in the evaluation that the child was taking food initially that 3 times in a day, now it has been increased to 4 times in a day. So that becomes enough. Or sometimes you may say that child is taking the amount 1 bowl in a half bowl earlier, now the amount of food has been increased to more than that. So that kind of specifically you have to write it. Additionally, you have to measure for young child, you have to measure the height and weight also. Increasing in that also, if it is there, that you need to inform because within 1 day or 2 day you may not be able to see these differences, but if it is a long term, you can still measure this thing, or weight still you can see if there is any increase that you can mention in the evaluation column. Is it clear? Is it clear? Are you able to follow me? Yes? No?
Yes, ma'am.
Okay. If you have any queries, please ask me in between. No problem is there. Okay. In between also you can ask me if you have any problem. Okay. This is about imbalanced nutrition. Because this is one common one you get very frequently to write, because once the child is admitted in hospital, once the child is sick, child doesn't want to take food, refusal to food becomes very common. So this is one common one. You can go for it. Okay. It is not that I am telling you to write for all the child, but this should be on the basis of assessment you are performing on the child. Mind you. Okay. Next, impaired physical mobility. This I think in the last class also I have explained a lot. This impaired physical mobility, this might be related to what? Somewhere there is pain, there is discomfort, neuromuscular impairment, there is injury, maybe there is weakness because of some deficiencies, there is fatigue, Drainage tube is there, IV cannulation is there, catheter is there. Because of that, the child is not able to move out of the bed. There is imposed restriction of movement. What happens? In the hospital, once the child is admitted, we do not allow them to move out of the bed, right? Yes or no? Do you do that?
Yes, ma'am.
Yes. So this is an imposed restriction of movement. At least inside the ward or maybe inside the block, we can ask them to move. So this kind of imposed restriction is there. Either we do it or maybe the parents do it, because the parents are scared that child might fall or something will happen to the child. He is weak, she is weak. So we impose some kind of restriction, and somewhere it is, sometimes it is needed also, but then we need to see that it should not be unnecessary restriction we impose on the child. Okay, it should not be unnecessary. We can ask the child to move around inside the ward or maybe at least little nearby, outside the ward with the parents, that we can give. So this kind of things we need to see. If we do this, there will be the physical mobility will be impaired. Okay, are you clear about this? What you will observe on the child? Inability to purposefully move within the physical environment. Okay, including bed mobility. Inside the bed also, child cannot move by himself or herself because IV tubings are there, some fixations are there in the lower extremity or upper extremity. Transfer and ambulance inside the in the bed itself, the child cannot move. Limited range of motions, because somewhere pain is there, the child cannot perform the range of motion. Decreased muscle strength, control and mass. Fatigue is there. We are asking them the child to be on bed rest because of some indications. Some indications are there. We are asking them to be on bed rest. There is paralysis somewhere. There is inadequate gross and fine motor skill. Now, what are the gross motor skills? Just give one example of it at least. Gross motor skill.
Ma'am, walking,
Walking, standing, walking,
climbing stairs.
climbing stairs. Okay, these are the gross motor activities. Now this starts with the head control actually by 3 months. Head control, head leg is there, and by end of 3 months, the baby is able to hold the head in erect position. That is the first gross motor activity, gross motor development. Okay. Then sitting, standing, with help, without help, then walking, then running. These are the gross motor activities. Sometimes you will see that because of maybe some other factors or maybe some conditions, the gross motor activities on the child is not appropriate for the age, not well developed. Okay. So these are the observations you will make on the child. You will see. You should be able to see. Okay. Next. What is the goal we will be taking? The client or the child will have improved physical mobility. Here you need to mention the timing. Suppose drainage tube is there, when the child will be able to move normally, or maybe cast or traction something is there, how long it will take. In that case, the time will be longer. Yes. So those are the things you need to see. By what time the child should be able to perform the normal physical mobility. Now, what are the interventions you will be taking for that? Assess muscle strength, joint mobility. Can the child move the joints? If there is any pain, ability to move, perform activities of daily living. Now, once you have pain, what happens? You cannot perform your daily activities. The child cannot have food by himself or herself, cannot go to toilet. Okay, this kind of activities, there will be inability, you will observe inability. Okay, these are the things you are going to observe on the child. Assess imposed mobility, immobility due to cast or traction, if it is there. Avoid unnecessary restriction in activities. provide age-appropriate activities to facilitate mobility. Okay, now, for example, if it is an infant, allow the infant to crawl, maybe over the bed, dangling at the bedside, standing with support. This is for an infant. Similarly, if it is a toddler, you can ask the toddler to be around, to move around inside the cubicle or maybe inside the ward itself. You can ask. So this will be age appropriate activities you should be advising. Okay? Position change. If the child cannot move at all, position changing you have to keep it in mind. Coordinate rest and activity. When you give the period of rest you give after each activity, you have to schedule it. How long you will be giving some kind of activities, and after that, or it might be the daily activities also, or maybe you are involving in some other activities so that the child moves. And then one period of rest you have to plan it. Perform exercises as allowed. Some restrictions might be there. Whatever exercise you can allow, that has to be allowed. For example, joint mobilization exercise, muscle strengthening exercise. This can be done. Range of motion exercises, you know very well. Teach parents about the hazards of immobility. Okay, they will take care once they know that if we do not do, this kind of problem might arise. Okay, so it is like once you are scared of something, you are eager to learn something. Okay, you see that if you do not take care of this, the child will be not be able to move ever, and this kind of deformities might be there. So once you tell them, they will pay attention to it. So you have to teach them how to perform the exercises of each part, body parts. Okay. Suppose one part cannot move, the other part how the child can move, that you have to teach. On evaluation, what you will be seeing, the child's activities level. Okay, activity level. For example, if there was some kind of devices are there in the lower extremities, and that has been removed, and then because of that, initially child was not able to go to toilet. Now the child can go to toilet by himself or herself. IV tubings are there in the arms, so it is being removed now. Because of that, child is able to feed by himself or herself. So earlier, child is not able to feed by himself or herself, not able to go to toilet. Now the child is able to go to toilet, able to feed himself by herself, or brush his or her teeth. Like that, what kind of activities earlier not able to perform, and what kind of activities now the child can perform. In evaluation, you are supposed to write that. Child can perform this, child can perform that. Got it? Understand?
Yes, ma'am.
Okay. We'll go to next. Nursing diagnosis, another one. Disturbed sleep pattern. Okay. So the moment you are not getting your own sweet bed, the environment is a different one. You are going to hospital, your sleep is disturbed. Similarly, with the children also this thing, the same thing happens. On top of that, there is some illness. What illness is there? Because of that also, it might be giving pain, it might be giving some discomfort, there might be surgery. Because of that, the child is not able to sleep. Now, what illness is that? That you have to specify. Okay, you simply cannot write that disturbed sleep pattern related to illness or the disease process. Please do not write that. So, because of the discomfort in the abdominal discomfort or pain in the leg, something, whatever is applicable that you can observe in the child, that you are supposed to write. Okay. Environmental change. It is related to the environmental change. There might be lots of sounds, different kinds of sounds. Maybe ventilator is connected nearby the patient. Different kind of sound it is giving. The lights are there. Whereas at home when the child is sleeping, there was no light or dim light is there, but here bright light is there. Because of that, the child is not able to go for sleep. Psychological stress. Sometimes what happens? The Mother has to attend to a young child at home, and that child, the mother is not able to attend at hospital. So that gives stress to the child. Even though some other figures are there, maybe uncle, auntie, or whoever is there, but the usual caretaker or the mother is not there. Because of that, the child might be having the stress. Okay, because of that also child may not be able to sleep. External factors in the environment. Okay, some other work is going on somewhere, and that is disturbing. Because of that also child is not able to sleep. What you will observe on the child? Interrupted sleep, that once the child is going for sleep and many times the child is getting up, irritability, restlessness, lethargy, there will be fatigue, there will be separation anxiety. Separation anxiety will be there. The child will be repeatedly remembering the mother. Child is separated from the mother, and child is telling about the mother. I want to go to my mommy. I want to see my mommy, like that. The mother is, child is going to tell you. Disorientation. Sometimes, if disorientation, oriented and disoriented, you understand, na? Once there is deprivation of sleep, it is likely the child might be disoriented. If the child is at hospital also, child might say that I am in home. Okay? Weakness. So these are the problems you will be observing on the child. Okay? This is related to these factors. What factors it is related to, that you need to specify. And then this will help you to assess, because these are likely. So subjective data, whatever parents are saying or child is saying, that's okay, but then what is your observation? Objective data, you are likely to get this. Okay. Goal. Child will be able to sleep without difficulty, interruption, and the child will appear rested. That is your goal. Okay. Assess sleep pattern. Intervention. In the intervention, first you will assess the sleep pattern. Frequency, sleep problem. See, sleep pattern, when you have to see the sleep pattern, it is the pattern, okay? It is not the 24-hour sleep. This is the sleep pattern. How the child is sleeping before admitting to hospital? What is the pattern of sleep? Like daytime, how long the child sleeps, and then night time, how long the child go for sleep. If it is a young child, daytime also the baby is likely to sleep, infant and toddler, and then night time also they are going for sleep, and how long they usually go for the sleep. So that you have to assess. Okay, usually how long they sleep in night time and how long they go for the sleep during the daytime. That you need to find out. That is the pattern you have to see. Frequency, sleep problem. Is there any problem that child is frequently getting up? For a young child it is normal. Pattern of awakening and what is the reason? Okay, the mother can tell you. Restlessness, weakness, fatigue, yawning. These things you have to observe. Now for your reference, I am giving you this. An infant usually goes for sleep 10 to 12 hours per day. For toddler, 12 hours per night, including 2 naps, that is daytime. Preschool child, 10 hours per night, 1 nap, sometimes without a nap, and school child, that is 10 hours per night. This is the standard one. Usually the child goes for this, but not necessarily. This has to be there. Some infant may sleep less than this, or may sleep more than this. Okay, but then this is the usual pattern for reference. So this you need to assess properly. If child is sleeping only for 10 hours at night time, you cannot expect that child will be sleeping more than 10 hours when the child is in hospital. So for that purpose, you need to find it. How long the baby sleeps, and daytime, do the baby goes for sleep? These are the things you need to find out. Next, position in front, back or side leg. That is the comfortable position. And some babies, newborn babies, they like sleeping, they enjoy sleeping in prone position also. Okay. Avoid interrupting, because you have to give medication, you have to check the vitals. After the child is sleeping, you are going and interrupting. So that you should be preferably avoiding. Okay, before the child goes for sleep, you should be trying to finish it. But some of the things you cannot, like if you have to give some medication and that is a must, that you should be giving, but then that can be scheduled around the child sleeping schedule. Follow routine at bedside. Sometimes what happens, like the when the child goes to bed, that time the mother used to tell a story, or mother or someone used to tell a story. Baby has the or child has the habit of hearing the story and going for the sleep. So those rituals, or some child they like to have their preferred toy at the time of going to bed. They hold it. Or some child may be having the habit of listening to music. So whatever the rituals they are having, they are following at home, you will be preferably trying to do that in hospital also as far as possible. Okay. Provide quiet and warm environment, nightlight, diaper change. If the baby is wet, definitely going to wake up. So this has to be done for a long time. Avoid painful procedures prior to bedtime. The size will get exaggerated once you do any painful procedure before the baby is going for sleep. So that might interrupt the sleep. Ask parents to hold the child until asleep and stay with the child at night. Especially this is very important. You should tell that night time especially you should not leave the baby. Once they are awaking, then they are seeing that the mother is not around, the person who is attending is not around, the child may be frightened. In that case, so child will not be having, they might not have trust on you, on the parents also. So this is very important that parents should be around. Ask the parents to follow the same schedule for sleep. Like usually the child used to go for the bed at around 10 or 9:30. So if possible, around that time itself, ask the parents to make the child sleep. In evaluation, what you will see, does child go to bed without problem? Like the rituals are not there, the same rituals you are following, and then child will comfortably go for sleep. Child is getting the preferred toy, child is listening to the music, or maybe he is able to listen to the story, whoever is telling, the parents or the someone else, the child like to hear. Doing the ritual, the child will easily go to bed. Not doing that, child may have problem in going to bed. So these things you should see. Sleeps how long? Appears rested or not. So these are the things you are going to write in evaluation part. I hope this will help you to write the nursing care plans. Some more we have. I have some more. I'll take in next class. Is that okay?
Okay, ma'am.
Some more are there. Some more are there, and please go through it. Please go through it once, and that will help you a lot. I hope. Okay. So we'll leave for today here only.